Topham, bringing you the best of beauty. Today, we're going to be discussing Restylane Silk, newly FDA approved for the perioral area. So Restylane Silk is a hybrid of Restylane, meaning that it has been put through almost a sieve, and the particles that come out are much thinner and much more appropriately used in fine lines of the upper lip, not giving a bumpy, lumpy look, which sometimes Restylane can give. It's approved for lip lines around the mouth. You can actually create the vermilion border. You can increase the philtrum, which are the two little columns that go from your nose to your mouth, as well as lip augmentation. The duration of longevity of Restylane Silk is probably somewhere between 3 to 6 months. Clinical trials have shown that it can last up to 6 months. We do offer several different modalities to make this procedure more comfortable for you. One is that Restylane Silk comes with lidocaine in it. The second is we can use topical anesthesia as well as mini nerve blocks, which I feel is most efficacious, especially if we're doing a combination of periorally injecting the fine little lines, redefining your vermilion border, and injecting your lip itself. There's no reason to make you in a lot of discomfort. For the detailed work that I need to do, I want you to be comfortable while I'm injecting you, and it's a very safe amount of lidocaine that we use. So now we're doing a mini dental block. This is called Hurricane, which is just going to numb the area before I give her a little injection. The reason I'm going to give her an injection is because there is lidocaine in Restylane Silk. However, this is a mature mouth where there are several little tiny fine lines, which I will show you in a second. And I'm going to redefine her vermilion border, which is where we would typically put lip liner, as well as give her a very soft augmentation of her upper and lower lip. So we're going to be using a needle, and we're also going to be using a little micro cannula in her lip itself, which reduces bleeding in the lip itself, but a cannula can't get into these little tiny fine lines. So I'm going to go ahead and take these out. So I'd like to point out a few things. In a mature lip, we have got a series of, can you give me a little kiss face? Little tiny fine lines, relax. We have a little loss of definition of her vermilion border where you'd put lip liner. We also have a loss of her little philtrum columns, and we have a little loss of volume. So I'm going to start with injecting her vermilion border and then some of these little tiny lines. So to add a little bit of stability to her lip, I'm going to just fan a little bit of material. For a more youthful look, we want to give her a little philtrum column, which goes right from the tip of the cupid's bow up towards the nose. So I'm going to put a little pinch here. Now to inject the inside of her lip, I'm going to use a cannula. I like to use the micro cannula technique to avoid bruising. So I'm going to put a little punctate here. So now I'm using the micro cannula, and I'm going right inside her lip itself. I'm going to ask you to open your mouth slightly, and I inject, as it's called retrograde, as I am coming out. The last thing we want in a classy, mature woman is a duck pout look. So you can clearly see, you know, she has a little bit of swelling here because of the Novocaine that I just gave her, that she has a nice vermilion border, and she has a little bit of a lull or lack of structure. So I'm just going to lay a little tiny line through the same hole that I was just in. Again, if you went crazy with this, you could create too much volume, which we definitely don't want. But this is just going to give her a very youthful mouth. I'm Lisa Topham. Thank you for watching. Please, if you'd like more information, visit my YouTube channel and visit me on Facebook. Thank you.